The World Health Organization defines stress as follows. Stress can be defined as a state of worry or mental tension caused by a difficult situation. Stress is a natural human response that prompts us to address challenges and threats in our lives. Everyone experiences stress to some degree. The way we respond to stress, however, makes a big difference to our overall well-being. And this woman clearly is under a great deal of stress. She's shedding a lot of hair, and now she's had that added stress of losing her hair and worrying about that. So there's short-term stress. Our bodies produce hormones, steroid hormones called glucocorticoids, which actually help the body adjust to potentially harmful changes. Whether it's illness or physical stress or emotional stress, our body has the way of reacting to it. It mobilizes white blood cells, it changes our immune system, changes us biochemically. In humans, that specific hormone is called cortisol, which we know does increase during times of stress. All of this is good because it helps decrease the inflammation short term and helps us respond to the stress. The problem lies when it becomes chronic stress. During periods of long-term and chronic stress, these persistently elevated levels of cortisol can lead to impaired anti-inflammatory effects of the immune system. This can lead to chronic infections, chronic inflammatory autoimmune diseases, and some hair loss falls into those categories. It may also affect potentially cancers. There's a lot of research going on about that. There's no question that chronic stress and these elevated hormones can affect us biochemically, making us more susceptible to psychological disorders like depression and anxiety. Fortunately, there's a lot of research ongoing to determine all the factors involved, but it's an incredible amount of information that is being produced now. And the research that I did for this webinar was overwhelming for me. I'm hopeful because a lot of research is going on. I think we'll have a better handle on things as we move forward. So now I'm going to turn it over to Kim.
Stress and hair loss. Ultimately, the adrenal gland produces cortisol, and in turn, these triggers the mast cells to degrade in the skin and the hair. And this has been studied. It's called a neurogenic inflammation because it comes from the neuroendocrine system. It is thought that it's the cause of the hair to shed. To put it in scientific terms, I like to use simple terms when it comes to teaching my patients, is that when you're stressed and you feel like you're ready to burst, your mast cells are ready to burst. And that kind of makes the assimilation to our neuroendocrine system. I think when we're talking about cortisol, cortisol and the elevation of cortisol is what causes stress. I like to go back to the beginning. In 1936, Dr. Reichman identified the structure of cortisol. And overall, in the same year, Dr. Seeley introduced the concept of stress and becoming the father of stress research back in 1936. His experiments showed us a lot about how the stress, cortisol can actually alter the immune system and gut health. And it's so interesting because a lot of research has been done in like inflammatory bowel disease, where, you know, we associate that with stress. And also now the immune system being affected and actually causing, hair loss. It's important to understand when we're looking at stress to look at the HPA axis. This was actually proposed back in 1950. In the presence of stress, our midbrain or hypothalamus will trigger and release a hormone called CRH, which then tells the pituitary to release ACTH. This is a little scientific, but I love the fact that this axis works for us all the time. Fight or flight are constantly, our brain is talking to our adrenal glands and making cortisol. So yes, there's been definitely a lot of studies showing that both stress can cause and worsen several different types of hair loss. Things that we look at in the clinic is excessive shedding, which is so important. You know, shedding, when a patient with excessive shedding, it's not like I'm losing a few hairs. it's extreme. I feel like the stress of even the shedding can even make the situation worse. It can prolong the resting phase for hair. It can increase inflammation, which I'm going to show you in a little bit. It can attack and accelerate and actually destruct the hair follicle. And there's another, cause of stress, where we pull our hairs because of the stress, and it kind of calms us in ways, and that's called trichotillomania. And also it accelerates the aging and the thinning of the hair loss, which I'm going to show you. There was an article in the Harvard Gazette on the science and technology, which describes the discovery of a molecule that was shown to stimulate the stem cells at the base of the follicle. During these times of stress and chronic stress, elevated cortisol were shown to block the secretion of this molecule, and actually thus increasing the loss of, of hair at that time. I think a lot of stress can accelerate hair loss, some of, even the androgenic hair loss, which I'm going to talk to you about in the next slide. During stress, there are definitely times of pro-inflammatory states. I think for myself, I learned a lot about stress, particularly physiological stress during COVID. The cytokine storms that we saw, in COVID patients, and the amount of stress on the entire body, the inflammatory response was unbelievable. And actually, it's kind of what has led a lot of research into physiological stress, inflammation markers, and looking for autoimmune in a lot of these processes. Types of hair loss that we can, plays a role. We've done a lot of research, and we know that stress plays a role in a lot of hair conditions. Telogen effluvium, alopecia areata, scarring alopecias, and others. It definitely, there's a direct cause, and, the neurogenic and inflammation appears to contribute to this immune system or dysregulation of the immune system. Telogen effluvium is probably one of the hair loss entities that we see a lot of, particularly in the past three to 4 years. Traditionally, we lose about 50 to 100 hairs a day, but this number gets excessive. The hair is released into the telogen phase. It can be sometimes greater than 200, sometimes even more. What I feel is that it's a global hair loss. In the clinic, we see, patients will come in and they'll see hair everywhere. It's not just in the shower, it's on their pillow, it's in their kitchen, it can be even, on the the dining room table. And I feel like that's when that extreme, it's scary. And I really feel for a lot of patients who experience this. Usually it's a more global loss. It's not a single area. And the temple area, since it's thinner to begin with, it seems to get thinner more so than the rest of the scalp. Shedding can take up to 6 months, and unfortunately, it's really difficult. As long as you have the trigger, and we know, treating it, sometimes it ends a little bit sooner, but up to 6 months is when we can see it. Telogen effluvium we can see in high stress. I've seen it in a lot of the crash diets, a lot of the new weight loss medications on the market. I can see it in thyroid abnormalities, low iron, and changes in hormones and medications. Some of the treatments that we do for TE is, first of all, I think it's more important to make sure you found the trigger. And in a stressful event, sometimes what happens is we have a stressful event that happens 3 to 6 months ago and we forget about it, and the hair lags behind. So finding the trigger, making the diagnosis is paramount. Eliminating the stressful events, of course, is the most important. Sometimes I do use minoxidil because it does prolong that growth phase and helps the hair like basically stick to the scalp. Although this is probably the only time when minoxidil is not like a forever, treatment. Supplements really work. I think nutritional deficiencies and decreasing stress, counseling, good sleep, diet stress reduction are so important. Telogen effluvium, basically postpartum and post-COVID is when we saw a lot. I think I learned the most about stress and hair loss during this time. And again, it is a very scary time, but one thing is once you fix the trigger, you actually can get full hair return. Trichotillomania, this is an impulsive control disorder where patients actually pull out their hair. This is one time when I really, and I've seen a lot of, this entity with COVID. I felt like the stress of that year and a half, 2 years, again, usually they have an underlying or psychiatric issues present, stress, anxiety, eating disorders, obsessive compulsive, and definitely, we've treated a lot of patients with this. During that time, I felt that getting them the help that they needed was super important. Definitely behavior modification plays a huge role. Stress reduction, particularly it's very common in college age young women, where, you're studying and you're just, pulling on your hair constantly in one area. Cognitive therapies, antidepressants, and supplements have been noted to help. Minoxidil to stimulate new growth. And there is limited studies, but Botox has been used to treat these patients.